Good afternoon. I'm Dr.BanchaChernchujit from Thammasat University, Thailand. Thank you, the committee. So thank you, Nam and TRB company for invitations. So today I'm talking about the role of osteopaths in sport medicine. Right? I just took this picture 5 minutes ago with Naman. So this is a view from the room. Natra is really nice. Yeah, it's like look like Pattaya in Thailand. Yeah, really nice. And thank you the committee VAS and HAS committee, yeah, for inviting, and also thank you the TRB company. So today we are talking about the viscosupplement in sport medicine. In the past, we are thinking about viscosupplement in old patient, right? In ONE, but actually nowadays it's very common. Yeah, we're getting older. Naman getting older, right? But we're still very active, right? We're still doing sports, and sometimes we have meniscus problem. Sometimes we have patellofemoral joint problem. We have cartilage. We have meniscus root tear. So that is very common. And anyway, we don't like to do arthroplasty. Okay, so this viscosupplement help a lot in sport medicine. Yeah, I think in our populations, our sport medicine do a lot of viscosupplement injection comparing to the joint guys. Yeah, so nowadays that prove that the elite athletes may prone to have early joint degeneration. The viscosupplement improve the pain and function, inhibit the expression of inflammatory and nociceptive mediators, reduce the breakdown of the endogenous HA, stimulate synthesis of the HA, and the chondroprotection, reduce the pain and risk of adhesion after the surgery. So how about the HA, intraarticular HA injection in the young athletes? We found that it's effective and very safe and has a role in pain involving articular damage, which it works well in early arthritic change and also in severe arthritic change who have no benefit conservative treatment. So this article proves that the intraarticular HA injection result as well as steroid injection, but less complication, right? So in my country, many patients, they concerned about the steroid injection. So I think in Vietnam also, right? Nowadays, we know that steroid is really effective, but in long term, you may have some complication after the steroid. Yeah. So in terms of effectiveness, it's the same. Yeah. So this is the algorithm for retreatment of visco in ONE, recommend from Euro Visco group. Yeah. Euro Visco supplement consensus group. And they conclude that, yeah, this is very close to us. They conclude that this viscosupplement injection strongly recommend in early arthritic change, the young age. Yeah, this is, you get strongly in favor 9, okay, young age, and rapid progression of OA, professional sport athlete. The patient that have contraindication for surgery and don't want to do surgery, want to delay the surgery. So you have the I think now and you experience also many surgeons, many patients don't want to do surgery or don't want to delay the surgery. And some patients have a lot of comorbidities, like they have heart disease, they have diabetes, they have a lot of complications from medicine. So these are the indications to do the viscosupplement injections. Okay, this patient will need the chondroprotection properties of the HA. Okay, so this chondroprotective action, we are talking about this, yeah, the chondroprotection. It is indicated for the knee. Now it's proved the knee, shoulder, hip, and ankle joint. These are very effective. So inject every week for 3 weeks. The effect will last about 6 months to 18 months. So because of this small to medium molecular weight of the osteoid, 1 to 2 million Daltons, it will have both pharmacological properties effect, okay, and also reducing the inflammation. And another ways on the mechanical properties that would lubricate the joint to reduce the joint friction. Okay, that is the viscosupplement properties of the osteneal. So this is a study. They did the study in 3 zones of cartilage, were analyzed before and after overnight incubation in saline, and comparing to the HA. There's 6 HA in this study. Yeah, and they found that the osteneal, yeah, they are very effective in means of, they found that the osteneal can improve the cartilage elasticity up to 22%. Yeah, comparing to normal saline and other brands. Yeah. So this they also found that the osteneal can penetrate into the deep zone, the subchondral layer of the cartilage, that improves the cartilage elasticity. This is another study. This is the RCT study. They collect the patient visual analog scale, WOMAC score, and MRI after the injection, and conclude that it significantly improved the pain score, cartilage volume after 6 months of the injection. The cartilage volume tend to improve after the 6 months after the injections of the osteneal. This is another study about the effect or effectiveness of the osteneal injection, comparing to the quality of life, delay of surgery, yeah, total knee replacement. So significantly reduce the pain and function of the patients after the injections. So that's include that osteneal can reduce the pain and improve the function of the patient and delay the total knee arthroplasty. So we can conclude from this study that the pharmacological chondroprotective effect of osteneal will improve the cartilage quality, synovial properties, and also improve the cartilage volume and delay of the surgery. We did the study about the patellofemoral joint. I think in our Asian people, we have activities sitting on the floor playing, so we have a lot of patellofemoral joint arthritis comparing to the Western. So is it effective, the patellofemoral? Yeah, actually that's very few study. So we did the study comparing the steroid injection, comparing to osteneal plus. So osteneal plus actually is not available in Thailand yet, but I think it's available in Vietnam, right? You have everything. You have osteneal, osteneal plus, and osteneal for tendon injection. So in Thailand, we have only osteneal. Osteneal plus is going to launch in Thailand very soon. Yeah. So we did the study in 60 patients, okay, isolate patellofemoral joint arthritis, comparing steroid and osteneal. Yeah, we follow the patient for 6 months. So that's my technique of injection. I blow the air into the joint first, about 3 cc's. Yeah, I bend the knee 90 degrees and then inject. So the upper one is the osteneal plus, the lower one is steroid injection. Okay. So I use the needle number 25G, small one. Yeah, sterile technique. No silocaine injection because it's the same needle. Okay. So after injection, always shake the knee. You can feel the air and fluid mixed together. We call switching sound. So if you have this feeling, you can read in my articles. You feel that this is your injection is inside the joint. It's not in the soft tissue. Okay. Always touch the cartilage. If the patient has osteoarthritis on medial side, you inject from the lateral soft spot. If the patient has lateral OA, inject from the medial. Okay. Do not inject in the same side because you touch the subchondral bone. It's painful. Okay. Number 25, touch the cartilage. No pain. Just touch. Gentle. Yeah. And don't forget to check. You make sure that the viscosupplement is getting the joint. Yeah. This is a result. There's no difference in pain during the injections. Both groups have significant improvement of the VS score and Kujula score. We collect the patellofemoral using the Kujula score from the first injection to the final follow-up at 6 months. In the first week of the VSS score, the steroid is better in the first week because steroid respond very fast. Okay, but after that, for the VS score and Kujula score, we follow the patients. There's no difference. Okay, at 6 months. So that means osteopath is very effective comparing to the steroid, but have less complication. Okay, so that's a conclusion. Actually, the osteopath was worldwide, launched in 1998 in Europe, long time ago, and now sold in 70 countries. Okay, but it just launched in Vietnam and Thailand, right? More than 20 million syringes was used. Okay, so for the safety, it's really safe because this is the low to medium molecular weight. So you have less chance of the pseudosepsis or reaction, severe reaction comparing to the large molecular weight. Okay, so it's quite safe and also it's sold around the world. And also there's like the sponsorship for the London Olympic Games. Yeah. This is the pharmacy guide for the London Olympic Game 2012. Yeah, and actually it's used in many countries like Germany, UK, and France, and many national football teams use this osteopath. Yeah, so this is the pictures of the athletes that use the osteopath like Bayern Munich, Dortmund, Schalke, and these are the experience of the athletes. Yeah. They use this. They found that there's this very positive reaction to an osteopath injections, and this is another feedback from David Thompson. He also feel good with the injection. He feel like the pain relief and the stiffness of the knee gone after the injection, and prolong his professional career. Okay? Keep him playing in non-league games.
Regardless,
Yeah.
but that probably helped. It helped me further my rehab.
He has a meniscus surgery.
Get over little hurdles that I had due to bits of pain and discomfort. Probably took about a week to settle in, a week or two to really notice the difference. But yeah, I definitely did, because sometimes it was painful beforehand. I'd highly recommend it based on my experience. Not been detrimental to anything I've done, and I've played another 10 years since, so it's been great.
Real players, real lives, real football.
Okay, so for the WADA, regulations, the anti-doping agency, this viscosupplement is not the problem. Yeah, we can use it. So also I use that for the patient that have the knee arthrofibrosis. Like this patient, we did the just KD3F with the ACL, PCL, and also the MCL reconstruction. So the joint gets stiff after surgery. You see that after injection, you can feel the backflow of the air. That means the joint have small volume, right? A lot of contracture. So we did the injection for 3 shots, right? And then do rehabilitation. The patient can feel that the arthrofibrosis is getting better, and the patient can move better. Yeah. So I think that's straightforward, right? If you have scar tissues, you inject the oil into the joint, make the joint, lubricate the joint, the feeling, the range of motions come back, right? So in my practice for the multiple ligament, this is very useful. Yeah. And also it's safer comparing to steroid, right? If you inject steroid into the joint, you feel not happy because you reconstruct, you put the graft in. Yeah, you may infect after steroid injection. So I think it's safer to do viscosupplement for the patient have stiffness. Yeah. And also I have many patients that have to perform ACL reconstruction, especially the complicated ACL with meniscus, with cartilage problem. Visco also works very well. Yeah. He's very active, 54 years old professional athlete. I did the surgery for him. You see that has radial tear of the meniscus, the cartilage problem. Yeah, I repaired the radial tear and also cleaning, also fight, remove the loose body. Yeah. So, and also inject the viscosupplement. I do 3 shots for him. Yeah, because at that time it's a COVID time. He don't want to come to hospital many times. Yeah, so we do 3 shots of the osteopath. Yeah. So the patient feel very good, very well. Yeah, you see after injection. But if after injection, you cannot move the knee. The patient have so much pain and cannot walk out of your clinic. That means you inject into an ACL. You inject into the soft tissue. Okay, very careful. Test with the air first, because when you put the air in, you can feel like there's no resistance. Okay, if there's no resistance, that means your injection is inside the joint. It's not in the soft tissue. Okay, and I use the small needle because if you use big needle, anywhere you can inject, right? Even you have resistance. But for small needle, you can inflate the air only when you are in the space, not in the soft tissue. Okay. So this is his result. He can go back to play and got the medals, right? He's quite happy, yeah, because even he is 54, but he's still like playing football, yeah. So this is another one. He has a PCL injury. He has cartilage problem. I do the injection for him. So the PCL tend to have stiffness, right? Because we also delay the rehabilitation for the PCL. Okay. So after the injection, this is about 6 weeks. After that, the patient start to move. This patient have patellofemoral joint problem also. Yeah. The patient feel like the knee is getting better. So this is an interesting case. She has the trauma. You see that? She has malunion, traumatic osteoarthritis of the knee. I did the osteotomy for her to correct her valgus deformities. And she's very active. She like to run. Yeah. So after the injections, after bone heal, now she can go back to marathon and she got the medal. You see her medal? Yeah. She's now very happy after collect the axis of the bone and viscosupplement injections. Yeah. So this is another interesting case. You saw a lot of meniscus root, right? Meniscus root always combined with also necrosis. Yeah, in your practice, right? Yeah. So this patient come a bit late. She has meniscus root tear. She come to see me like 4 or 5 months after that, and the patient start to have some also necrosis of the medial femoral condyle. So I still save her cartilage and I make a window, make a microfracture dealing, and then viscosupplement injections for her and repair meniscus root, collect the axis. So we have 3 operations. Yeah. And now she's quite happy. The medial joint line pain is gone. And also this also necrosis heal. Yeah, you look at the x-ray. Okay. So this is another benefits, yeah, of the viscosupplement that reduce the scar tissue in the joint and also improve the cartilage regeneration. So this patient have the patellofemoral joint problem. You see a big defect on the trochlea. So I remove the cartilage, okay, doing the abrasive chondroplasty in microfracture, okay, put the scaffold and viscosupplement injection. The patient also quite happy, yeah. This is another beach volleyball. She's the gold medal of SEA Games. Yeah. Both of them always come to see me before the games. Yeah, to do injection. And she's always got the medal. I think because of this. Because the volleyball player, badminton player, they have a lot of the patellofemoral joint problem. Yeah. So we're taking care a lot of the national team. This is a football player. She is the ACL meniscus root tear and knee stiffness after that. So viscosupplement improve his function. Okay. This is also the national athlete. He is the shot put. He has patellofemoral joint problem also. Yeah. So after the injection, the patient getting better. Yeah. So in Thai, he said the feeling of the knee stiffness and sound in the joint is getting better after the injection. So I think in conclusion, actually that's many, yeah, but I cannot tell you everything. So in conclusion, this intra-articular HA injections has a lot of roles nowadays in sport medicine. Yeah, not for just the elderly patients, but in our young active, yeah, middle age, yeah, also have a lot of benefits. Yeah, if you read in the literatures, that's a lot of benefits of this viscosupplement injections. Even the improve the pain and function of the patient, inhibit expression of the inflammatory reaction, reduce the breakdown of the cartilage, and stimulate the synthesis of the endogenous HA. Okay, and improve the knee function. Okay, so that should be the end of my talk. Yes, so this is the our combined meeting in September. I would like to invite our Vietnam friends to Thailand. Yeah, you see the beach is same like Nha Trang, right? Yeah, so please come to Thailand, 29th of September to the 1st of October. Yeah. Thank you.